As I just mentioned a moment ago on the audio version of the Big Bid Theory, this is indeed our first ever entree in having a quote official video version of the podcast. Some of you might be raising your hand saying, "Hey, Bill, what about the end of season 7 when you had Emily Feenstra from ASCE on the video version of the show?" Well, yes, we did. And Stephen Hetzel from Bid Prime as well was kind enough to join us at the end of last season. But again, I think when we look at the history book of this show decades from now, we will call this episode the first video version. And who better to have on the show than our good friend, a guy who we have kind of coined as the public health expert for the Big Bid Theory, but Dr. Rodney Rohde joins us. And Dr. Rohde, how are things down in San Marcos today?
Things are great, Bill. Again, thanks for having me on. It's always an honor and a privilege to join you guys. I'm excited to talk about today's topic.
Yeah, a little bit of history, first of all, before we embark on this episode. Again, Dr. Rohde, the name, the voice, not foreign to our longtime listeners, now viewers, but it was back in 2016. We went into the history books. That was the very first episode. You and I don't know if you remember, but we discussed Zika.
Yeah, I do remember that.
Yeah, and then you hit the fast forward button, and it was March 10th of 2020 when you and I got behind the microphones on the audio version of the show, and we discussed what was kind of a new story at that time, COVID. Here we are 2+ years later.
Right. You know, it's an unbelievable, surreal thing to think about, right? That it's been, I guess, 6 years since we first talked, but even that pandemic beginning is almost kind of surreal to think about.
Yeah, and the date, again, when we kind of went through the history books, I thought March 10th, that wasn't long after the major networks were talking about it and it became a topic. So there is a little bit of pride, quite honestly, on this side that we were so early on, again, bringing an expert like you on the show. So something, again, we kind of tip our own cap that we were talking about it back then. But anyway, I do want to go through Dr. Rohde, if you'll bear with me, Dr. Rohde, your background a little bit, even though, again, you're not a stranger to many of our listeners and viewers. But Dr. Rohde is the professor and chair of the Clinical Laboratory Science program there at Texas State in San Marcos, as we joke. Also, among his many roles, he is the program chair for the CLS program and holds the rank of professor in the College of Health Professions. Dr. Rohde also serves as associate director for the Texas State University Translational Health Research Center. And I could go on and on. If you look at Dr. Rohde's bio, Dr. Rohde, did I miss any of your key roles there, here, everywhere?
That is plenty of the roles and the hats that I wear, as we both know.
Yeah, no doubt about it. Okay, so off we go. So newsflash, COVID is still here. 2+ years since COVID was first reported. We talked about it. We visited here on the show. So as you look back, Dr. Rohde, and by the way, we don't politicize things here on the Big Bid Theory. That show is over there, or the podcast is over there if you want to talk about the politics. But in terms of public health in the United States of America over the past year or two, what have been some of the good things that you and your peers have observed, and what are some of the things that we still need to get better at?
Oh, wow. Yeah, great topic. Great lead off on this. 2.5 years later, Bill. So just a quick snapshot. We just passed the 1 million mortality figure in the United States, which is, very sad. And most experts globally are talking about this. The numbers show around 5 to 6 million, but many people believe that that's a hidden kind of number, that we might be looking at 10 to 15 million dead just because of unreported deaths in certain developing countries and things like that. And I tend to agree with that. I think it's going to be much more significant when we look back historically. When I talk about kind of what we're opening up with, again, 2.5 years ago when we chatted about this, and we didn't know a lot. It was a novel virus. It was brand new. And as you and I have talked about, and I've talked with so many others, it took a while, and it's still taking a while for some people to kind of understand that with a novel virus, things are changing rapidly, almost in real time. Viruses are the most notorious mutators on the planet, and science can't stay up with that sometimes in real time. So we've learned some lessons, Bill, some the hard way, some things we got right, some things we didn't. So I'm going to talk to you a little bit, a few minutes about what I think are some of the big pieces. There's a lot to unpack here, so certainly we can't get to everything. But I really look at this pandemic now, 2.5 years later, in terms of kind of my background. I look at it in a public health slant, kind of the world, the US, kind of what's kind of happened, and also in a healthcare slant, because I think there is a niche, kind of specialized area there for healthcare. But when you think globally, I think one of the good things that came out of this, if you look back, was how amazing the warp speed and the ability to transform a vaccine really in about 300 days from the time we need the genomic sequence to the actual authorization of a COVID-19 vaccine. That is in itself a miracle. Most vaccines take years, some 5, 6, 7 years to really get through the pipeline. So I think one good thing, one of the top things in my mind, public health wise, is that the US government and many others, went into this, we have to do something. We have to get rid of some of the red tape. We have to move things through. And they did it in a way, I believe, at the time is the safest way they could. They still pushed it through FDA approval and things like that. And we got it on the market. You remember that thing came out and we started rolling out vaccination. The acceptance of vaccination, vaccine equity across the world are different problems. We still know that in the US, we're approaching only about 65 to 70% fully vaccinated. We need to be better with that even today. And globally, it's problematic from the standpoint of equity and money and economics and things like that. So that's, I think, kind of a good and bad point. I think we all know now that really, science communication and trust in our healthcare systems and our public health systems have been challenged. Again, I think that is something we need to learn that lesson, myself included, going forward, that we're going to have to get together. This is one of many things a lot of my colleagues are talking about, and I tend to agree. We need a commission, Bill, a global commission, if not in the US, looking at what happened. It's still happening, but really looking at it in hindsight and going forward and trying to see where we went wrong and trying to see where we went right. And doing it, as you started with, in a non-political way, totally looking at it from a kind of a military, boots on the ground. What did we do right? What did we do wrong? And create tabletop exercises, create ways to empower healthcare at the local, state, national, and global level, because speed is of the essence during a pandemic. You really don't have time to sit around a table when it's happening. You do that, of course, but every minute it is a life. And so literally you have to be moving quickly. So I think that needs to happen. I think we've also learned, Bill, and I know you've talked about this, and we've talked about this off air, and I've talked about it with a number of people. When you look at what's happened in the past 2.5 years, I think if you think about education in schools, I'm kind of switching back into the public health hat here, I think we have seen that they're really what you might consider kind of at the top of the pyramid for a functioning society. I think we knew that as a society, but I think certainly when shutdowns happened and all of these children and adults at college level ended up at home, it impacted things like mental health. It impacted a parent's ability to make a decision. How do I deal with this? Can I stay home? Do I have enough time to stay home and handle this sort of thing? And so I think, again, going forward and analyzing, while technology is beautiful and we're doing it right now, Zooming and doing the things we're doing globally now, it may not ultimately replace the need for human contact, human interaction from a mental health aspect. I think it's really impacted our society across the world. I think it's changed the way we work. Who would have thought 3 or 4 years ago that we would be holding global conferences, that entire universities, including Texas State, pivoted to, at least in most areas, not so much in healthcare areas, but in most areas, pivoted to online virtual learning. I myself have said it before, was not a fan of that prior to the pandemic. And I still believe in certain things like healthcare. You have to get in the water to swim. You have to be in the classroom. You have to be in the laboratories. But in certain other areas, it's a very impactful tool. It makes the world smaller. We've had classrooms where we're talking with people from Africa now and other places around the world. Just really helps with some of that cultural learning and things like that. So done right and done correctly, I think work world is different. I mean, we're seeing it all over the place. And if I could flip just a minute, Bill, to healthcare, kind of a different commentary here, because I think in healthcare, we've learned some lessons around we have to find a way to prepare for this massive increase in service demand. I know you have loved ones in healthcare. My mother had to experience healthcare right at the beginning of the pandemic. And while we always have known if something happens, even something as simple or tragic as a multi-car fatality or a short outbreak with influenza or something like that, and this massive need for services, for blood, right? Even coming from the lab standpoint, when you need blood or when you need ventilators that we all saw, or you need supplies, we have to think about that supply chain. That is a core issue that's still going on. And it's certainly impacting healthcare and other areas of our society. But, I could go on and on in the healthcare side of things, but one that I'll mention, and maybe you have some more questions for me, is personnel. And we've talked about it before. You cannot create healthcare professionals overnight. It takes years, and it takes a pipeline of recruitment and retention to have enough healthcare professionals in the world. And some of the data we're seeing in the medical laboratory and nursing and other areas that are critical to patient care, Bill, I've talked about it as being kind of a hidden national crisis, and I don't think it's as hidden anymore, but I still think people don't realize how critical and fragile our healthcare system is from the personnel side, from expertise. People are burnt out. People are tired, and what's sad is they're not just leaving a particular area, they're leaving for good. They're switching careers and becoming realtors and things like that. So I'll kind of slow down here and let you pick my brain a little bit.
Yeah, well, thank you, Dr. Rohde. That's a great entree, and many of the things that you touched upon, we've actually addressed on this show.
Right.
And you mentioned my wife, and it's not news to anybody who's watched this show for a while. My wife is a nurse, and yes, I remember the last time you and I visited, you kicked off season 7 of the show, and you talked about the crisis when it comes to medical lab professionals. And I guess my question here is, in our day jobs, we see public sector entities, they outsource for many things, and that includes lab services, that includes requests for lab supplies, lab construction. As a matter of fact, I just saw a request for lab construction that came across the desk literally just today. So there's a lot going on in terms of public sector entities going out and requesting staff and supplies,
Right.
and whatnot. But you talked about the mass exodus. Well, and I hate to say this, but in short, what can be done to kind of stem the tide?
Yeah, that is a great question, and one that we're still investigating. I just got invited by the American Society for Clinical Pathology to sit on a workforce shortage committee. So again, a national level committee to start look at our profession, medical labs. You already mentioned nursing, so it's not just us, it's healthcare, including physicians and others that are dealing with fatigue, mental health issues, burnout, all the things we've talked about, retirements. And so I don't know if there's one perfect answer, but we certainly have to find a way to bring in more professionals, right? So recruitment is ongoing and important, but also retention. That's really where we're kind of bleeding, so to speak. So many people leaving, and we really can't replace them quickly. One comment and this isn't just my idea, other people have talked about, is we may have to look at better ways for the United States, for example, and Texas, to empower and allow a more rapid but accurate process for foreign experts to work in the US. I mean, it's where we are. Of course, we have to do it properly and make sure the credentials are right and their expertise is satisfactory to our standards. But we may have to find a way to, again, to cut some of that red tape down, again, safely and accurately. These are not easy things, as you know, in the world we live in from a security standpoint. But I think we're there, and I think it's happening anyway, with respect to being a little slower process, but it's certainly happening. One of the ongoing issues, Bill, this doesn't answer your question per se, but in nursing and medical lab, these two are really important areas in respiratory therapy, because, you know, with ventilation, so kind of talking about COVID, these particular areas, I call it the free agency effect, right? So an analogy with sports, we all love free agency when you get the right player and they make your team better. And that's true in healthcare. The danger, Bill, is when you suck away the seasoned veteran from a hospital that has no other veterans or very few. And so the analogy is that you may help Hospital X in Midland, Texas, because you offered them a $20,000 signing bonus, and that's happening in the medical lab, and a better hourly rate. But now Austin, where they left, particular hospital is devoid of an expert in blood bank, and you just don't find those overnight. You can't, even with trading and trying to do this across the US, it's really difficult. So it's become a free agency effect. Good for our salaries, right? Our professionals like that, but we're really hurting communities by pulling seasoned veterans away. That's just one issue. And so I don't know how to address that, but it's one thing we need to figure out.
Yeah, and it's certainly a reality, no doubt. Travel nurses,
yes,
increase in that and all that. And one of the things we've also seen an increase in, again, to kind of circle back to the start of the pandemic a couple of years ago, and again, I refer to our day jobs here, but we have noted, and it isn't a news flash again, but thousands upon thousands of requests for PPE, every variety of PPE that you could conceive of. It's out there, state, local, federal, universities, K through 12, law enforcement, putting in requests for different items, different services. And one of the things we've also noticed, and we look at the data quite often and thoroughly, but there's been an increase in solutions, services, and products related to hygiene and sanitation. So
right.
You have a number of government agencies watching right now, Dr. Rohde, private business leaders watching right now, school administrators. So when it comes to hygiene and sanitation, what would you recommend, if they aren't doing it already, what would you recommend they do right now?
Yeah, again, a very complex and nuanced situation. Certainly
Sure.
PPE and infection prevention and control are critical. It always has been. And I think I'll try to address this in a couple of ways. One way in healthcare, I think we're looking at many areas in healthcare now where masking and other types of PPE may become more mandatory. What we've absolutely seen, the data shows this, again and again, I talk about it, it shows it, that we have absolutely lowered and sometimes almost eliminated respiratory types of infections within healthcare occurring by wearing good, effective masks. And again, that's a whole nother show on the types of masks, but certainly good and effective masks. And we just know it works, Bill. It absolutely works. Do you need it every day in society, which is a different topic? Maybe not. But in healthcare, we're really seeing the pluses of that. So I think that going forward will be something you see more healthcare professionals wearing masks, maybe all the time going forward, especially in immunocompromised areas, long-term care, ICUs, things like that. But even when people come in to visit, I think you're going to see more mandates on, unless something changes nationally, that if you're coming into our hospital and whether we know it or not, we're going to enforce a mask and hand hygiene and things like that before you go in to visit grandma or someone who's in ICU. So I think that's going to occur. In the other part of the world, with respect to infection control and prevention, this is an area I work in, and very nuanced and complex. But the topic of smart buildings is really bouncing around the world with respect to, as we build new buildings and maybe renovate old buildings. We saw it here at Texas State. Thinking about smart materials that don't harbor microbes as well. So getting down to the root cause of surfaces being an issue. And really more so than that, Bill. And you might remember this when we talked 2.5 years ago. Everybody was freaking out about surfaces. And I think it was a good place to start. You worry about things being on the surface when it's something so novel. But in reality, looking backwards, maybe not as big a problem for this particular bug as something like a bacterium or a fungus or something that's more hardy in the environment. Having said that, what is important is air turnover and air control. So if you're in that space, and if you're not, I'd encourage you to look at it. You're seeing a lot of research and effort in air, turnover of air. We know in an airplane, they turn it over. And by that, if your audience doesn't know what that means, it's the exchange of air in a building or in an airplane or a bus or anywhere else. It's really important. It's why we want to go outside, get outside to do things. It's safer. It's always safer to be outside. So that air turnover, I think, is going to be an important conversation as we go forward.
Very good. And Dr. Rohde, obviously, we would not allow ourselves to end this interview without asking you about lab professionals. I'm looking at my calendar here. Medical Laboratory Professionals Week was the end of April, and we save lives every day. I know it's a mantra of yours. You are so passionate about your industry, about what you and your peers and everybody involved, what you do to help society. So before we exit stage left, is there anything coming up on the lab professionals calendar that you'd like to share with our audience?
Sure, I'd love to. Thank you again for that opportunity. And again, thank you for mentioning Lab Week. That was a couple of weeks ago. I know Nurses Week is just completed. Let me start there. Healthcare professionals, I think sometimes we get, just like everybody else in the world, we tend to get into silos. And we all are important. You absolutely need every one of us doing our jobs accurately and correctly every day, 365 a year, right? So we all are important, right? Nursing, medical laboratory, respiratory therapists, pharmacists, across the board are important. But with respect to medical laboratory professionals, we always like to say that we're the backbone of healthcare and public health. Without us, your physicians and others are basically guessing. You cannot do anything without medical laboratory data. And coming up, two things that I'm involved with that most of the US is we have two big national meetings coming up this June. I'll actually be speaking on how to be a subject matter expert from a medical lab standpoint at the American Society for Clinical Laboratory Science. It's going to be in Grand Rapids, Michigan at the end of June. And then in September, the American Society for Clinical Pathology will have their big 100th annual meeting, and I'll be a part of that. And that's just two of them, Bill, at the national level. There are many state and regional meetings that are going on all the time. And if anybody in your audience has children, nephews and nieces, grandkids that are interested in science and math, and even if they're thinking medical school or things like that, don't forget about these other amazing healthcare professionals, including the medical lab, diagnostic detectives. So if you're interested in that sort of world, check it out. Look me up. I'm happy to talk to anybody. We need you in our sites for the future.
All right. Well, Dr. Rohde, again, can't express enough how much we appreciate you helping us yet again, visiting with us on the very first video edition of the Big Bid Theory.
Thank you so much, Bill, and have a great, great year.
All right, you as well.